Hi, I'm Antonio Mora. I'll start today on a personal note. Am I concerned about the coronavirus from a health standpoint? You bet I am. I've had mild asthma most of my life, so I have an underlying condition. I'm also old enough to fall into the category of those the CDC is telling to pretty much stay home and stock up on supplies. 2 weeks ago, I wrote about how fear can paralyze, but how it can also spur us into making crucial decisions necessary for survival. The problem is how to find the right balance between a healthy fear and an unhealthy freaking out, which unfortunately is what a lot of people are doing now. A bigger dose of fear early in this coronavirus crisis would likely have made the governmental response much more effective. Having made tests easily available then and taking other aggressive measures would have given us a clearer picture of what was happening in the U.S. That might have saved lives, slowed down the outbreak, and limited the number of Americans who will contract the coronavirus disease. But the geniuses in Washington and many in the media couldn't help but play politics. In the early going, the right, including President Trump and his media supporters, generally dismissed the threat to the U.S. as a politically motivated fuss over very little. The left and its media acolytes preferred to attack Trump instead of cooperating and working toward solutions. Fear of this virus is completely rational. Anthony Fauci, the respected head of infectious diseases at the National Institutes of Health, whom I've had the pleasure of interviewing on numerous occasions, just testified before Congress that the U.S. could see millions of cases of coronavirus and that COVID-19 is 10 times deadlier than the flu. Harvard epidemiologist Mark Lipsitch estimated that 40 to 70% of the Earth's human population could potentially be infected in a COVID-19 pandemic. In that worst-case scenario, we could see not only millions of cases, we'd have millions of deaths in the U.S. Still, people ignored the warnings. In one example, just a couple of days ago, passengers were still flocking to cruise ships at the port here in Miami, even though the State Department had already warned Americans to stay away from them, and we'd seen how people on various cruise ships had gotten sick and needed long quarantines. There is no doubt that the virus is spreading rapidly around the world, as you can see by how steep the curve is in this graphic from ourworldindata.org. Also, because of the failure in early testing, COVID-19 could be far more widespread in the U.S. than we think. But when experts say the risk is low for people who take proper precautions, we should listen and not panic. Here's some perspective. Only about 1 in 17,000 people in China have contracted the disease. Only about 1 in 450,000 has died. Your chance of getting struck by lightning during your lifetime in the U.S. is 1 in 3,000. Sure, the numbers in China are far worse if you focus exclusively on the areas that suffered severe outbreaks. But even then, according to data from Johns Hopkins, Hubei province, where the virus emerged, has only seen an infection rate of 0.11%. That means barely 1 out of 1,000 people got the disease. 99.89% were not infected. Also, while the disease is rarely deadly for those under 60, as you can see from this Vox graphic, it is especially deadly for those over 80. But a large majority of them survive too. It is hard to get accurate numbers, but the median death age in Italy appears to be 81. The average age of death in China, according to a February 12th study, was 75. And the U.S. Surgeon General said the average age of death worldwide was 80. In the U.S., the average age of the first 38 people who died is reportedly 77.75. While somewhat more contagious than the flu, it is far less contagious than the measles, and the number of daily deaths around the world is a lot less than from tuberculosis, hepatitis B, pneumonia, AIDS, malaria, shigellosis, the rotavirus, or the flu. We should keep that glass half full perspective in mind, while remembering that there is likely a greater danger from doing too little than doing too much. Seemingly drastic measures to close schools, postpone or cancel sporting events, shut down entertainment venues, and limit large gatherings could be crucial to flatten the outbreak curve. Look at the difference in the bigger bell curve of estimated cases when protective measures were not taken and the lower one when they were. We have real-life examples of how this has played out and how Singapore and Hong Kong contained the virus with early measures, compared to Italy and Iran, who did not. The hope is that the U.S. has acted quickly enough. Even so, we should not forget the enormous economic pain that will be inflicted upon millions of Americans from those closings and tough protective measures, far beyond the huge losses in the financial markets. The economic pain from the coronavirus could impact many more people than the illness. True leadership is needed in Washington to protect Americans from the coronavirus and all its consequences. In the past, times of crisis have united us. The tragedy of the coronavirus should not be compounded by our poisonous political environment.